Interface Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home.
Hi, and welcome to Fairfield Today. My name's Rick Snyder, community educator with Fairhope Hospice and Palliative Care, and we're at the Pickering House home. No, we're at the we're at Fairhope, home of the Pickering House. But we could be at the Pickering House, home of Fairhope. I guess that's how you look at it. But we are going to be doing a show today on COVID-19, and it's being recorded the first week of August. So, as everybody knows, the COVID kind of changes as it goes. So. We're as up to date as we can. And joining me, as always, is Fairhope's CEO, Denise Bauer. Denise, good to see you.
Good to see you. Thank you.
And we have a special guest with us. Would you care to introduce him for us?
Sure, I'd love to. We have Dr. Varney, and Dr. Varney is our Chief Medical Director here at Fairhope, and does a lot of things on a daily basis to help us. So he guides the medical care for our organization.
Glad to be here. Good morning.
Yep, and Dr. Varney, you've I don't know if you read this in your medical book or not, but now that we have the pandemic going on, it's really kind of readjusted, especially how we work at Fairhope. I know it's changed society, but at the end of life, do we still have, I guess it's a stupid question, do we still have the same restrictions as everybody? At the end of life as far as visitors, any kind of restrictions?
Well, we here at the Pickering House, we have been able to open it up a little bit where we can provide a little bit more visitation than some of the folks are experiencing in the community. The hospitals, for obvious reasons, have to limit the throughput and to prevent the spread of the virus. Mm-hmm. So visitation is extremely limited. At the nursing homes as well, it's an extremely fragile, frail population.
Yeah.
So the nursing homes, again, understandably, are doing everything they can to prevent spread, which means extremely limiting visitation from the outside. At the nursing homes, most visitation is happening either electronically by FaceTime or through the little podcast things, and some of it through windows. They'll have the visitors come to the outside of the patient's room or the resident's room, and they can call on their cell phones and talk to each other because they can't hear through the windows.
Yeah.
But the windows stay closed so that the virus can get through a screen. So they leave the windows closed and they can talk to each other and see each other through the glass, and they can talk on their cell phones or on an iPad or something like that. So.
Wow, that's interesting. Denise, I can see with this illness how it's caused changes. Maybe some of these changes will stay.
Yeah. Well, we're kind of hoping that some stay. One good thing that's happened for hospice is before COVID, we were not able to provide telemedicine or telehealth. And so one of the things, with the state of emergency in the country, there were a lot of waivers given for healthcare. That was one that affected hospice. So, our staff are able to do telehealth, telemedicine visits. So, we can do that, just to help with the limiting of the spread and to protect others. It seems like people are really open to that. We do have staff that are visiting. Of course, our aides have to provide personal care in person, and our nurses are doing a lot of visiting. And then the chaplains and social workers as needed, but they're able to do a lot of it, through the telehealth. So that has been great for us. And really, when we think about it, a lot of people have really enjoyed that because it's pretty responsive. Even if they need something quickly, we can get on the phone or our iPhones and things and communicate with them, and they feel pretty engaged at that point. So it's been a great thing for us to be able to provide that care, especially in outlying areas, but we do in-person visits as well. So I hope that stays around. I hope that government allows us to continue that.
Yeah. Doctor, are you involved more with the telemed?
I'm doing a little bit of both. When it comes to home visits and such, I basically reach out, make contact by phone, and ask what their comfort level is, knowing that we all practice the mask wearing and the social distancing on our visits and et cetera when possible. There is some hands-on that has to happen, obviously.
Absolutely.
But I usually reach out to the caregivers or the patient and ask what their level of comfort is. If they want me to come in person, I'm more than happy to do that. If they're a little uneasy about the whole situation and just wanting to exercise an abundance of caution, then we can do things by telehealth.
Oh, okay. You know, probably shouldn't say this on the air. I have my annual physical coming up, and we're going to do a telemed. And I'm thinking, well, this is pretty cool. I can hide the broken leg. I can hide all the stuff. We'll see how smart my doctor is to go through, analyze my limping and all that kind of thing. But yeah, and that really is so many, I'll say procedures, doctor's visits are casual, if you want to call it that. You know, checkups and how are you doing after the surgery or whatever it is. And I think that's one of the things that might pick up as far as medical procedure in the long run.
Well, what a lot of people, I think, don't realize is the physical exam isn't all physical. When I examine a patient, a lot of my examining is happening with my eyes.
Yeah.
So during the discussion, the question, by the time I get to the point where I stand up to go over to the table to lay hands on the patient, I've already got most of my physical exam in my mind as far as what I've observed, how they walked into the office, how they sit, how they posture, whether they speak clearly, articulately, and fluidly. So there's a lot of the so-called physical exam that is not physical at all.
Very interesting, and I believe that even when you're talking to somebody, personally, you can see them fidgeting as opposed to on the phone. You know, I'm talking to somebody on the phone, I'm sure going, you know, but I don't see that.
Right.
You know, and so that, I think, is interesting. And yeah, the body language says so much. And along that line, I know palliative care. One of the advantages of palliative care, we go into the home and we can maybe see little things that aren't being done anymore. Going to the doctor's office, they can't tell that the dishes haven't been washed when they used to be.
Right.
Yeah, they can't see that they don't vacuum anymore when they used to be meticulous. So there is an awful lot to say about the one-on-one, the physically being there, you know. I can see our chaplains sometimes, it is more or less conversational even when they visit. You know, they're not as much looking at physical, but I think everybody in our company are involved with everybody. I mean, we are looking at the physical. Volunteers, when they go in the home, they can see changes and all that, and that really is important. And that's one of the things that the anything doesn't pick up too much.
Right. Well, the telehealth requires also a visual component. So we're not just calling people on the phone and having a conversation. When we're doing our visits, in order for these to be valid, there has to be an audio and a visual component. So they can happen on like a FaceTime, where then the phone can be turned toward the resident. The nurse can be in the facility or a visitor in the facility, and they can contact through FaceTime, or they can do any of the other electronic methods of communication that include both an audio and a visual component simultaneously.
Oh, okay. So yeah, it is much more than just a flat screen right in front. I mean, there are other components. So, well, Denise, just out of curiosity, our census maintained a steady rate? Not that the COVID would affect it, but people have asked me. Are we still busy?
we have. We've been very busy. We've maintained our census for the most part. Some ebb and flows, but one thing at first when the COVID hit the area was we did see a decline in the patients we had in the Pickering house. And part of that was we were really kind of avoiding some respite days, not bringing people in unless we really had to, almost emergency situations, so that just to limit that, contact. We do have things set up at the Pickering house where we can, if we need to, isolate patients. So we have, in the Pickering house, we have 12 patient rooms. We have there's a lounge between the first 8 and the last 4. There's a lounge areas. So we have it set up so that the last 4 rooms could be for COVID patients if we need to. And so we could isolate them. We could have separate staff taking care of those patients where they're not taking care of other patients. So we haven't, had to really initiate a lot of those protocols. A lot of the care we're providing for COVID care is patients in their own homes, in the hospitals, and in nursing homes and assisted living. So we're providing a lot of care. But at first we probably saw a little decrease, off and on in our census, but overall it's been pretty busy. Patients still need help. They still need the hospice and the palliative care team. And like I said before, it's been very successful being able to do some telehealth too. So that we can, and we actually do some of that on admission even at times. And like Dr. Varney said, a lot of it's what people are comfortable with. We don't want to cause any safety issues with people. As you can see, we have our masks. We wear them throughout our facility. We're very diligent in following the CDC guidelines. If you walk into the Pickering House, we are checking people's temperatures. We're asking them the screening questions that we're required to make sure that they're safe. Earlier, you talked a little bit about visitation. We are allowing 2 visitors at a time to come into the Pickering House to visit patients. So oftentimes families will just rotate that, and there'll be 2 come in, they'll leave, 2 more will come in. And part of the reason we do that is, like Dr. Varney said, there are things that we have to consider. And we have regulations to follow, but we know at end of life it's really important to have that visitation. And not everyone here is end of life. Sometimes people are here to have their symptoms managed or just give the family a rest. But it's still important to maintain those guidelines for us.
A good thing you just mentioned is not necessarily here for end of life.
Right.
That is what so many people equate the Pickering House to, whether we're in a virus or pandemic or not. They associate people coming here to die, and you said they don't. That's one of those little things. And speaking of end of life, how is our grief situation? We have a grief department, where we follow people on after the passing. Are there any changes, I guess, would be my question.
There sure is, Rick. One of the things that we're doing is we're actually providing a lot of telehealth with our grief team, because as you know, we take care of families that have been on, the loved ones have died on our hospice for 13 months after the death. So we have that bereavement team that sees people, but we also have grief support for the community for people that haven't been on hospice. So all of our grief team is working remotely, and they are actually doing a lot of telehealth. We actually have grief groups that are telehealth, that are Zoom meetings. I guess they're not really telehealth, but they're Zoom meetings for groups. And that has been really successful. So I don't know where that's going to take us, as we move through COVID, if we'll continue to have groups that are like Zoom meetings, but it's been very successful, and our grief team's been able to reach out and help a lot of people. So, really the grief goes on too. And as you can imagine, with all the restrictions and all the problems that people in their own lives and their personal lives have experienced with COVID, that grief is a huge issue right now for people. So it's keeping our grief team quite busy.
Yeah, and I know the mental health area of society is dealing with the depression or the removing people from being in society. So there's an awful lot of spin outs from this. And I guess, Doctor, you also have somewhat of a private practice, right?
Yes, sir.
So are you also doing the telemeds and
Yes,
visits?
we do. One aspect of my practice is the nursing home care.
Okay.
And we have several patients in a couple of facilities around our community. Some of the facilities would sometimes want us to not be in any more than we have to be, just to limit how much opportunity to spread the virus occurs. So there have been occasions where we use telehealth in the facilities. The staff that are the essential staff there in the facility would then assist with establishing the electronic communication and allowing us to conduct our visits that way. So that's been helpful. Through my own small private practice, which is basically just an addiction management practice, we also have been able to use those type of electronic communications and be able to maintain keeping folks in their treatment program when they can't come to the office or shouldn't come to the office because of exposures or symptoms.
And I would think the treatment program probably has its own set of emergencies if somebody's in a rough situation, I guess, where you do have to sometimes get there or at least react pretty quickly.
Right. We try to make ourselves pretty readily available. Most of our clients have us on also social media where they can reach out to us on the private messaging side of that to let us know that they have something going on that needs our attention.
Yeah, you brought up a good point, I guess, Denise. Everybody complaining about Facebook. Facebook has really come in handy during this pandemic. Communication, transferring knowledge, most of it true, I guess, I don't know. But, there is that openness, or at least people can reach out. And if nothing else, they can just watch. You know, they don't have to be involved. But and you also are coroner.
Yes, sir.
So, boy, we could get fire department, the insurance sales.
No, nothing like that.
No, but it does keep you off the streets.
All just medical related. So.
Yeah, absolutely. And this is probably a dumb question, is the coroner, has your job changed with this pandemic? Are you busier, or?
Initially, yes. Initially, when this started, showing up in the community, there was a lot of meetings necessary, of course, to prepare and plan, and not knowing what to expect. Obviously, none of us knew what was coming.
That's a good point.
We had to try to be as prepared as possible. So we've worked very close with the commissioners and with the emergency management, and I think that everyone has really come together and worked well. As far as the coroner's office itself, it really hasn't had a major effect on us. We haven't really seen this overwhelming, amount of cases that needed to be evaluated. One of my biggest concerns, and I just addressed this morning with our commissioners meeting, one of my initial concerns was we were going to see a big increase in suicides because of depression from isolation, etc. And we've not seen that, thankfully. Looking back at our previous year's statistics, we're really much par for those statistics. So I was pleased to see that fear did not come to fruition.
Yeah, that's when you mentioned that, that's what I wrote too. Initially, this could be very bad for people with depression, but actually, maybe on the bright side, we've opened up so many avenues of contact now we didn't have before. Zoom meetings. I don't know if we had them before this, but I never heard of them.
Right.
No, not that often. No.
So. And Denise, Dr. Varney brought up a point that we didn't know what was going to happen. We've had to adapt. We've had to do the same thing, and we probably still are, aren't we?
Right, we are. The initial push, as many of you are aware, was to everyone needed to stay at home. And so that really created a challenge for us because we didn't have people working remotely, really. I mean, sometimes nurses or social workers or chaplains would leave from home to go see patients, but pretty much everybody was coming in the office quite a bit. After their patient care was taken care of. So the big change for us was to work remotely. And so we tried to fit people with computers, laptops and such, so that even some of our office staff, like our billing staff and them, if they could, remote into our server and be able to work from home, that was the ideal situation. So we did that. And so it really did change us. That communication piece is huge when you don't have people seeing each other on a daily basis. But it's worked quite well. A lot of our staff have been very successful working remotely. Even our nursing staff and our aides, leave from home and go to see patients and then go back home. So it's really worked quite well. People still come in the office. And of course, being the Pickering House 24 hours a day, 7 days a week open, there's staff here all the time.
Yeah.
So that was a huge change for us. But, that's something that we're looking at. How can, people still maintain some of that, even as COVID, hopefully decreases and, people are establishing their lives back into coming into offices and such.
Yeah, it has changed everything, And,
it really has.
And we still are. So, yeah, Dr. Varney, I guess the other illnesses are still just moving along.
It's pretty much been life as usual for me. The only real change that I've seen as far as just my general practice is it just slows us down because you have to stop at every door. You're screened in, you're screened out, and then at every door inside the facility you have to stop because there's a different protocol for protective equipment based on what their symptoms and illness are in their situation. So how much of the gown, mask, gloves, foot gear, all that you have to apply, dock and don when you're going in and out of those rooms. So the same amount of work, the same amount of patients, the same amount of care needs provided, just with those extra steps. So it has kind of made our days a little bit longer, but it really hasn't affected our overall day-to-day operations other than just the time involved.
Yeah, okay. And Denise, our visiting hours have changed now. You're talking about that in that we have 2 visitors are allowed per patient. Dr. Varney mentioned how the nursing homes are very restrictive.
Right. Well, we try to let families in, and many people have seen where they allow outside visitation, and we've done that too, where you can have a few more people. But we still have to try to maintain that distancing, have people wearing masks. So that's another, I know when this first came about, a huge challenge we had was no healthcare area was prepared with the personal protective equipment, the PPE that was needed. Mm-hmm. And we still continue to, try to collect that equipment because we know that this isn't really going away and we're going to need that. And so, the most important thing for us was to make sure that our staff were protected. People say, have you been exposed? Well, our staff are taking care of COVID patients, but they're not considered exposed because they have the appropriate protective equipment to prevent them from getting that exposure such that. So, we have protective N95 masks for them, we have face shields, we have isolation gowns, foot protection gloves. So we have all those things, surgical masks at times. So we have all those things in place, and it has been different for our staff. Like Dr. Varney said, it does take more time, and then just trying to, have that equipment and to make sure that people are carrying the appropriate things with them. Teaching staff regarding some of these things, because some, N95 masks were new to us. We didn't use those in hospice.
Yeah.
That wasn't something that we even had. So, just to obtain that PPE, we had one person, Becky Hinkle, working full time, just trying to get enough PPE for us. Wow. So now we are in the process of establishing an emergency preparedness storage area so that we keep all these pieces of equipment and we rotate stock so that they don't outdate. But just because we know that we're going to need this, and if there ever was another pandemic, we want to be prepared. Mm-hmm. So that is, it's taught us a lot. We work closely with all the local agencies, emergency agencies and such, because we're part of that community team. Mm-hmm. So we kind of share things, and we've been able to obtain some supplies in that fashion.
Yeah.
So we're still maintaining that to try to make sure we have the amount of supply that our staff need. Because when people come to the Pickering House, we have to give appropriate PPE to those families too. Yeah. To protect them. So there's a lot involved with it.
Oh yeah. I think one of the spin-offs we were talking about spin-offs as far as the COVID, the designer masks for a whole new market.
Yeah.
And somebody said Hanes, I think, was coming out with a line of coordinated fashion statements. So maybe we can get some Fairhope.
We are looking at that. Actually, we're on that right now. So we'll be having our own little line of protective, cloth masks.
When I was in sales, we always gave out coffee mugs and pens.
Yeah, now we're giving out masks and we have little hand sanitizers we give out too.
Yeah.
But I really want, if any of our volunteers, one of the things we have not been able to do is have our volunteers in the Pickering House and seeing patients and families, just because we want to honor the guidance that we receive for people to stay home and to try to, maintain that distance. So we miss our volunteers. So hi to any that are listening. We do miss you. But the other thing is, so our volunteers are trying to find things to do because they still want to help us, and they are helping us. Mm-hmm. So they've made us many cloth masks that our staff wear, and we sometimes have them for visitors and such. So, our volunteers haven't really stopped. They're still trying to help us in any way they can.
Yeah.
But it has been different. That's probably been one of the things I've noticed the most is just lack of all those friendly, helpful faces. I mean, we miss them. And, really when we look at it, they provide thousands of hours of care for our patients and their families, and they help in the Pickering House, and, that's been huge. So I'm sure people that volunteer in any healthcare facility are feeling that right now.
Yeah.
But, our goal is to try to get them back, when it's safe, to help us.
I come in periodically to the Pickering House periodically, and that's one of the things I miss, the volunteers, because they help with paperwork, they help visiting people in the rooms, they help everywhere, and they bring this normalcy. Yeah. They're just normal people coming in, not professional with a, I don't say agenda, but with something to do.
Right.
And I know we've basically stopped the volunteer program because our volunteers can't go into nursing homes anymore because of the restrictions. And we don't want volunteers, that many more people coming in here and exposing potentially. So that's a hard end of it. And I do volunteering as well. We've been able to separate being a paid employee and being a volunteer in that I only do what volunteers do when I'm a volunteer. I do the No One Dies Alone and different things like that. And that's something else we can't do because the volunteers can't go in to the nursing home. So. Well, tell you what, we're going to have to wrap this up. I don't know if there's any words of wisdom or not, because we don't know what's going to happen. Wash your hands, I guess. And that's something else. We're probably the cleanest society we've ever been. Everywhere you go, it's, you know, the antiseptic, the pens are clean, and that's something else. When we have volunteers, or excuse me, when we have visitors, we do clean the furniture, we do clean everything after it's been used. So it's looking good.
Yeah,
so
just use common sense. You know, the same kind of things, the same kind of practices that we should have always had in place. Washing hands and just using common sense.
Yeah, very good point. Well, Dr. Varney, I appreciate you joining us because you are a busy person.
Well, thank you. Glad to be here.
And I always learn a lot when Dr. Varney's sitting here. He was talking, oh, I didn't know that. Well, I didn't know that. Learn something every time, and Denise, it's always a good time.
Thank you.
So
Appreciate it.
I appreciate you, everybody watching. Hope to see you next time, and remember, celebrate life.
Interphase Video presents Fairfield Today. Brought to you by Fairfield Federal Savings and Loan, Fairfield Medical Center, Fairhope Hospice and Palliative Care, the Fairfield County Board of Developmental Disabilities, Dagger Law, and the Frank E. Smith Funeral Home. Dagger Law has been part of the Lancaster community for more than 110 years. This is where we live and work. You'll see us at festivals, sporting events, and all around town. We consider our clients as friends, and we walk alongside you through challenging times. Whether you're a growing business, a changing family, facing litigation, planning your future, or dealing with land issues, we're right here. We are local. We are trusted. We are experienced. Dagger Law.
Fairfield Medical Center took care of me like I was family.
I was made to feel like I was the only person that they were going to see that day, even though I knew that wasn't the case.
Everyone at Fairfield Medical Center was very attentive. They just put my mind at ease.
I was there for 12 days, and I felt comfortable there.
We were people to them, not a number. They took the time to get to know us, our personalities.
Well, they saved my life. You know, how do you beat that?
I don't know how I could have gotten through it without them.
Experience Fairfield Medical Center.
The Frank E. Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our two locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
Fairfield Federal. When it comes to our customers and our community, we go above and beyond to help. Our people make the difference.
We were retiring from Tucson, Arizona, and we made a retirement trip out around Ohio, having decided that's where we wanted to be. And we came across this town called Lancaster, and we fell in love with the downtown area where the fountain is and the memorials and the flags and all this stuff. And I looked around and I said, there's our bank right there.
There's something to be said about a community bank in your hometown.
Right. If you live in the community, you should do business in the community as much as possible. So it makes sense to bank with the community bank where you live.
Fairfield Federal is the bank to be at. If you live in this town, or any town actually, you want to bank at a local home bank. And the employees are happy here, they're conversant, customer service is through the roof. There's nothing more you could ask for.
Personal or business banking, whatever you need, we take it seriously because we know you do. Stop by today at any of our 3 locations and see why the difference is clear. Fairfield Federal Savings and Loan specializes in banking that revolves around you.
Member FDIC Equal Housing Lender.
Everybody has a dream. Mine was to see the ocean.